because we are doing a PowerPoint. Okay, I just need to move the Zoom controls over just a bit. Well, I guess I gotta move them over a bit more. There we go. All right, so Unit 2, I will say Unit 2 has a lot of information. Okay, so Unit 2 is just chock full of information. And I do like it though, because Unit 2 does have a common theme. And the common theme surrounding Unit 2 is preparing for battle, right? So Unit 2 is we have to learn everything there is to learn about our enemies, right? About the bad guys, about these pathogens. So we have to learn everything about the pathogens, and then we have to learn how to kill them, right? And that's what this unit is all about. So with chapters 5 and 6, I do combine chapters 5 and 6 into one big PowerPoint. I just think it flows a little better that way. And plus you do have the pre-recorded lecture videos, so that way you can just kind of, go, right from one into the other if you want to. And you don't have to stop, you don't have to go from one, chapter to another. But basically that is all about bacteria and how they live, how they grow, what they like to eat, all of their requirements in terms of, glucose and oxygen, what they like, what they don't like, what they don't care about. That's essentially what chapters 5 and 6 are all about. If you've already gone through chapters 5 and 6, that's great. I think that will help you immensely with tonight's information. If you haven't gone through chapters 5 and 6 yet, that's okay. It's just that you might be a bit lost, you might be a bit confused tonight, but you still have lots of time to get through everything that you need to get through prior to the test that's due on Monday. So you basically have, 5 or 6 days before you, got to get that test done. So chapter 7 is literally the chapter about killing the bacteria. Okay. Now, we don't say that. We don't say killing the bacteria. We say controlling microbial growth. But what it's really about is, okay, how to kill them, how to kill the bacteria. Okay. But it is how to kill them, outside of the body, in the outside world. Okay. Then in chapters 18 and 20, which is another combined PowerPoint, pre-recorded lecture videos that you need to do on your own. Chapters 18 and 20 are about vaccines and antibiotics. Now, they are two really important topics. We've already talked a little bit about both because we talked about how essentially vaccines were discovered and how antibiotics were discovered. So we talked about that in chapter 1, okay? And then they're not a huge topic for us for our class because vaccines are, a really big topic, but it's more of like a industrial microbiology, a biotechnology type topic. And then antibiotics are like a pharmacology, medicine, even like organic chemistry type topic. So we only do a little bit from chapters 18 and 20. So you'll notice that PowerPoint and those videos are really short. But of course, antibiotics in particular, antibiotics are all about killing the bacteria inside the body, right? So inside of our patient, how do we kill the bacteria? With antibiotics, right? So chapter 7 is all about killing the bacteria outside of the body, right? So not inside a living thing, but in the outside world, okay? And then we'll finish with chapter 14, and chapter 14 it kind of is a little bit of unit 2 and a little bit of unit 3, and it's kind of hard to decide where chapter 14 kind of belongs, but it's a really good chapter to kind of bridge between, exams 2 and 3. But it's like, if we put it in unit 3, then there'd be too much on exam 3. So we put it in unit 2, and yes, it makes exam 2 a little heavy, but not as heavy as exam 3 would be. So that's why, you know, it's kind of where it ends up. So like many chapters, we start with lots of vocabulary words. So I'm not going to read all these words to you because I know that you're all more than capable of reading words, making vocabulary words, but I will warn you that many of these words sound similar, right? They have some very close definitions, so be careful on the test, right? Make sure you're reading the entire question. Make sure you're reading all 4 choices, okay? Because you have things like sterilization and sanitation. You have antisepsis and asepsis, right? Then you have sepsis, asepsis. So read carefully on the test. I mean, you should do that all the time anyway. You should always read a test carefully and completely, but especially with these words. Make sure you know the definitions clearly, okay? So things like, when you think of the word sanitation or sanitization, right? This would be essentially what you do at home, in your kitchen, in your bathroom, right? You're sanitizing things. You're not sterilizing things, right? When you clean your kitchen, you're just trying to make it a clean, safe environment, right? Because you don't want your kitchen to be gross and dirty. You don't want to be getting people sick when you cook dinner, right? So you keep things clean, you keep things at acceptable levels, right? So sterilization is what they would do in like a surgical area of a hospital, right? The complete and total removal of all microorganisms. So it's an important difference between sterilizing something and sanitizing something. And very often, like you've already seen in microbiology, people will use these terms interchangeably, you know, like how people do with infection and disease. And it's not really correct, right? Another good example here is the words disinfection and antisepsis, because you cannot disinfect a person, right? So when you apply those principles to living tissue or a living person, we use the term antisepsis. That's where we get the term antiseptic. So antiseptic, most of you probably think of Listerine, right? Listerine is an antiseptic, not a disinfectant, right? Because Listerine, you can use that on living tissue. You can use that in your mouth, right? Now, can something be a disinfectant and an antiseptic? Yes, it can. We're going to talk about that. All right. So it's interesting, right? But you get lost a little bit in the semantics. You're kind of like, all right, well, you know, am I going to get in trouble? You know, like if I call Listerine a disinfectant, am I going to get in trouble? Well, no, but for our purposes, you know, when you're taking a test in a science class, you want to know the appropriate terminology. You want to know the actual correct definitions, right? So a disinfectant would be a chemical that's used on a non-living surface to kill microbes, and an antiseptic would be something that's used to kill the microbes on living tissue. So just go through these words, make your flashcards, however you like to learn vocabulary. Just make sure you know the definitions kind of word for word. Read them carefully on the test. Don't get them mixed up. All right, so another thing that's really important that I always kind of forget where it pops up. I know that it pops up. Yeah, it'll pop up here soon. But something that's very, very important that so many people do not do, myself included, because I'm very guilty of this too, is not reading the label of a chemical or a product, right? I mean, it's something that we're all guilty of, right? You know, you have these various different things, under the sink or in a cabinet. You have Lysol, or you have Clorox wipes, or you have bleach, or you have some kind of soap or detergent or chemical, whatever, right? And when was the last time that you actually read the entire label? Like, you looked at the back of the thing and you read it and you were like, this, you're supposed to do that. Like, you are literally supposed to read the label, because that label tells you how you're supposed to use it and what you're not supposed to do. So, like, it'll say, don't use it on this type of surface, or it'll say, make sure that you let it sit for 2 minutes, right? There's like some of these things, like, how often do you just like take the little spray bottle and you go spray, spray, spray and wipe it off immediately, right? There's a lot of things, if you don't spray it and leave it on for like 30 seconds or 60 seconds, it's not doing what you want it to do. Like, if you want it to kill the flu virus and you don't leave it on there for 1 minute, like you don't leave it on the surface, then it's not going to kill the flu virus. So you got to read the label. Super important. And that's kind of what this is talking about. There's a slide, like a few slides later, there's a slide that really says that, but I always like to mention it here too. So, one important thing is, okay, how dirty is the surface, right? Like, how gross is it? So if it's really dirty, right, the number of microbes, if there's a lot of bacteria, it's going to take longer to disinfect it than if there's only a little bit, right? That makes sense, right? The environmental factors, okay? So I give you an example of inside the body for this one, okay? If you have a patient and they're sick and the bacteria is in their blood versus, in their fat tissue, or if the bacteria is in their liver or in their kidney or in their intestines, right? That's going to affect the type of medicine, how well the medicine's going to work, right? Can they take the medicine orally? Does it have to be delivered in an IV? That's going to have a huge effect, right? Time of exposure, that's kind of what I was talking about before, right? Like how long you have to leave it on a surface. And then the characteristics of the microbe, that takes us back to, chapter 4. So is it an endospore former? Is it gram-negative or gram-positive? Is it encapsulated, right? So that's when you need to know your stuff about what bacteria is it, okay? Is it Staphylococcus aureus or is it Staphylococcus epidermidis? Is it Streptococcus pyogenes or Streptococcus pneumoniae? Is it Escherichia coli or Pseudomonas aeruginosa? You need to know that, right? Because if you don't know what bad guy you're dealing with, how can you possibly know how to kill it, right? That's kind of the whole point of our class. And that's a big part of being a medical professional. All right, here we go. Physical methods of control. That's a nice way of saying how to kill the bacteria physically. And we already know the number one method, Louis Pasteur, he's the one who told us this, 150 plus years ago, heat. So burn it or boil it, right? That's what Louis Pasteur told us. So he figured out that if you either, burn it with fire or set it on fire, it will kill it. The problem, of course, is when you set something on fire, you pretty much destroy it unless it's metal, right? So that's why our metal loops, right? Our loops that we use in lab, they're made of a metal wire, and they can withstand being put in the fire for short term. I mean, you can't leave it in there for a really long time. It will eventually, begin to melt. Same thing with the glass that we use. Okay, so glass that can withstand being in fire for a little bit. Okay, again, not really long, because eventually glass, it will break if it gets too hot for too long. So obviously fire has its limitations, but we know it works. Fire kills everything, right? Even endospores, even viruses, right? Even the most, because Louis Pasteur, he didn't do a lot with viruses. Viruses, what can you do? They're super, super, super tiny. We can't do anything with viruses in our lab. We don't have electron microscopes. We don't have the facilities to work with viruses. We can't do it, right? So, but we know viruses will die as well if you set them on fire. So the other thing that Louis Pasteur figured out is, of course, boiling, okay? Because lots of things, lots of, non-living things, things made of wood or glass or metal, and then, later on, things made of plastic, they can stand being boiled, right? So some viruses, lots of endospores can survive boiling. So then later on, we get even better at this with autoclaves. So if you don't know what an autoclave is, on page 183 is a picture of an autoclave. An autoclave is a piece of equipment that will actually heat up water under high pressures to where essentially you get to temperatures that are even hotter than boiling water. So not only are you exposing the microorganisms to extremely high temperature, but you're exposing them to extremely high pressure. And that will usually work on endospores and viruses as well. Autoclaving is what is used on surgical equipment. So, surgical tools like scalpels and scissors and clamps, as well as, surgical gowns and towels and all that kind of stuff. Anything that's going to be involved with surgery that's just not a one-time use disposable type thing, they get autoclaved. And autoclave, it works great. They kill all the bad guys and you're good. And then, of course, I had to throw in pasteurization again. We've already learned about pasteurization, okay? It's just the heating of liquids to kill the microorganisms. Very, very important for the dairy industry. So if you enjoy milk, then you have Louis Pasteur to thank. Also, if you enjoy beer and wine, but that, all right, so then we also have filtration. So if you ever wondered what a HEPA filter, HEPA stands for high efficiency particulate air. So, filters are also a big industry right now, especially with concerns about, the flu virus and COVID, being able to basically make these filters that are so sensitive and so tiny that they can filter out these viruses. I mean, you're talking about filters that work at the nanoparticle level. I mean, there's a lot of money to be made in, that industry, because you're talking about filtering things out that are that tiny. But, you're talking about in hospitals, the HVAC systems, and preventing people from getting the flu, and preventing COVID, preventing, spread of tuberculosis, anything that's airborne, anything that, is a respiratory disease. That's really, really important. Okay, and then so this is talked about in chapter 6, I believe. Sometimes I get 5 and 6 confused because I kind of mesh them together. But yeah, low temperatures, not very effective. Refrigeration, freezing will definitely slow down the bacteria. Doesn't really kill them very well unless they're just super, super sensitive. So yeah, using low temperatures, not a great control method. I mean, better than doing nothing, but not great. So again, if you haven't done anything with chapters 5 and 6 yet, that topic, it's a little bit lost on you right now, but it's definitely covered and super important. Definitely lots of questions on the test about temperature related stuff. Okay, so again, talked about pressure with autoclave. Now, when you just do pressure by itself, okay, remember we talked about how the cell wall of bacteria can help them withstand that a little bit, and then endospores, certainly the endospore layer will help them withstand that as well. So just high pressure by itself is usually not so great. That's why an autoclave will use a combination of high pressure and high temperature. Desiccation is the technical term for drying something out. So drying something out, kind of like with low temperature, not a great method, okay? It's okay in the short term, okay? It'll slow the bacteria down, but once the bacteria encounters some water, they just kind of, boom, come right back again. So trying to dry out the bacteria, trying to dry out a virus doesn't really work, okay? It'll work pretty good on a fungus, but we don't worry too much about fungal diseases. It's just not, it's not a big concern for humans. We just worry about bacteria and viruses pretty much. So then osmotic pressure, when we talk about hypertonicity, okay, don't get nervous. I know sometimes students, they get nervous when they hear osmotic pressure. This is just when we talk about hypertonic solutions. Increasing hypertonicity just means increasing the salt content, making things more salty. This is how back in the day before refrigerators, this is how they used to preserve meat. They would pack raw meat in big barrels of salt because it wouldn't spoil, because the bacteria just didn't like it super, super salty. So when they'd slaughter a pig or a cow and they'd have all this meat, they would pack it in salt and it wouldn't go bad. And then when they were hungry, you would take it out of the salt and you would kind of shake it off and you would cook it and then you would eat it. And it would be safe. It would be really salty, like the saltiest piece of meat you ever had, but at least it wouldn't be spoiled and full of bacteria and kill you, right? So that's what we're talking about. When we say osmotic pressure, we're just talking about like essentially making it really salty. So instead of drying it out, we just make it really salty. So again, it works in the short term, but it's only going to work so great once the bacteria kind of get a hold on it again. Now, radiation works great, and we use radiation a lot, but of course, very dangerous for living things. Just like, anything that's a living thing, you wouldn't use fire, you wouldn't use boiling, you wouldn't use an autoclave, right? Same kind of thing. You wouldn't use radiation, okay? You could only use radiation on non-living things. So I do want you to know the difference between ionizing and non-ionizing radiation. Ionizing radiation is the more dangerous type of radiation. That's gamma rays and X-rays. This type of radiation is used on medical supplies as well as the mail. So most of your mail is irradiated. So, literally they run the mail through X-rays so that any sort of, biological agents, pathogens are killed by the radiation. I don't think it works on anthrax endospores, though. Not that, I don't think anybody's sending anthrax to the mail anymore. I would hope not. But remember, anthrax, the only thing that we know that works is the chlorine gas. And then non-ionizing radiation is UV rays or ultraviolet rays. And that's actually what we use in our lab. That white cabinet that the safety glasses are in has a UV bulb in it. So when all the glasses are put back and I lock it up, I turn a little dial and that makes the light go on, and the UV light will actually kill any bacteria or viruses that might be on the safety glasses. So that's a non-ionizing form of radiation. It's a much safer form of radiation. It'll still kill the bacteria and stuff, but it's just less likely to, lead to cancer, that kind of stuff. UV radiation would be the same thing that would cause like a sunburn, that kind of thing. Okay, so that was all physical control methods. Now we're going to talk about chemical controls, which is basically the use of chemicals. So this is where, once again, I tell you, you need to read the label. Very important, okay? So, things like bleach, Windex, Lysol, Clorox wipes, Clorox, bleach, chlorine, bleach, Clorox, it's all like the same kind of deal. You should always read the label of chemicals that you're using. And like I said, I'm just as guilty as everyone else. If I'm cleaning my kitchen, I'm just going to pull out the Lysol wipes. I'm going to pull one out and just wipe everything down, and voila, the kitchen's clean, But it is important to read that label. Make sure that you're using it on an appropriate surface. Some things you're not supposed to use on glass versus wood versus metal, versus plastic, and most of us, it's like, okay, I guess part of the sink is metal, part of it's plastic. There's some glass, I'm sure, somewhere. And it's like, you just take it and you just wipe everything. And it's like, okay, it's clean, sure. So hopefully it's clean, I guess, So then one of, I think, one of our best labs is this one, okay? So actually, we don't do use dilution, we do the disk diffusion method. And here it is. So we're gonna do this lab, I think it's lab 9. Yeah, pretty sure it's lab 9. You would think I would know, right? Since I wrote the lab manual, but yeah, I'm pretty sure it's lab 9. So here's what we have. All right, we have 3 Petri dishes, and each Petri dish has a different type of bacteria that has grown on it. So the one on the left is Staph aureus, the one in the middle is E. coli, and the one on the right is Pseudomonas aeruginosa. So you have 3 different bacteria. Then the reason that this is called disk diffusion is because you get a little paper disc. That's what these little white circles are. And what you got to do is you got to take the little disc with a little, little pair of forceps, and you dip it into a chemical. So the one on the top is dipped in chlorine. The one kind of on the left-hand side is hexachlorophene. The one on the right-hand side is O-phenolphenol. And the one on the bottom is quat. Quat is like a detergent. It's like a common thing that they like mop the floors with, like in hospitals and schools and stuff like that. So then what you do is you put the bacteria on the petri dish, and then you put each little disc on there, and then you put the petri dish in the incubator, see what grows, and then you have to measure this thing called the zone of inhibition. Now, this is essentially what Alexander Fleming saw when he discovered penicillin, because what he noticed is there was an area where there was no bacteria. And this area where there was no bacteria became known as the zone of inhibition. The zone of inhibition is, if you look here, that's where no bacteria grew. And that's because the bacteria was killed. Like, the bacteria wouldn't grow there because whatever the stuff is, it was stopping it from growing. So now what I want you to do is look at these 3 petri dishes. And as always, you can either turn on your microphone and give me an answer, or you can type it in the chat box. You can send it privately. You can send it to everybody. I guess really the chat box would work better, because if everybody tried to do the microphone all at once, it would be crazy and loud and I couldn't understand it anyway. So let's do chat box. That would make the most sense. Okay. But if you want to send it privately, if you want to send it to the whole group, it's fine. Okay. I want to know, out of these 3, and you can abbreviate, so you can do SA for Staph aureus, you can do EC for E. coli, and you can do PA for Pseudomonas, okay? Which bacteria is the strongest, the scariest, the most powerful? So which one do you think out of these 3, which one was the strongest, the most resistant? Okay. Yes, I'm getting lots of correct answers. Very good. The Pseudomonas, the PA. Very good. So if you look here, okay, the SA was the weakest, right? Because look at all these zones of inhibition. Look at all this bacteria that was killed. All 4 of these chemicals, all 4 of them worked, right? You have 4 pretty good zones of inhibition where the bacteria was killed by all 4 chemicals. Then the E. coli, 3 out of 4 worked, right? Over here, 3 of them didn't work. Only the chlorine worked, and the chlorine only worked a little. Like, look how much the chlorine killed of the first 2. Pseudomonas is by far the most dangerous bacteria that we work with in our lab. So anytime that we are working with Pseudomonas, you have to be extra, extra careful. Whatever you do, do not get it in your eye or in an open wound, because this bacteria is nasty and it would love nothing more than to hurt you. And as you can see, it's very resistant to being killed by some pretty strong chemicals. So you got to be careful with the Pseudomonas, because it does not play around. So that'll be a fun lab, right? So we will do this very lab. Now, we're not going to use these. We're going to use like Listerine and bleach. And what else do we have in there? Listerine, bleach, iodine. Iodine's always a good one. Some other ones, I can't remember now. Oh, somebody's asked in the chat box about comments. So common infections that Pseudomonas causes. So a lot of times Pseudomonas is what's called an opportunistic infection. So Pseudomonas will wait until you're already sick with like, some sort of cold or pneumonia or something like that. And then it'll cause, some other kind of infection. A lot of times it will cause skin issues, eye infections, wound infections. It's a big one for wound infections. So if you have a really, really bad cut or injury and you're not, washing it or bandaging it or keeping it clean, and like if the Pseudomonas gets in there, it's almost like a flesh-eating bacteria type of situation. So that's one thing that it's real well known for. It's also just known for just being like in hospitals, like just kind of antibiotic resistant, chemical resistant. So, if you're in a hospital, if you're in a really bad car accident and you're in a hospital, you need surgery and stuff, it can get into you that way. That's usually like a Pseudomonas isn't something you're just going to kind of get just from being kind of out and about. If you have a strong immune system and you're an otherwise healthy person, just from being kind of out and about, you're not going to get it. You really have to be, either really sick or, you got surgery or you had an accident, that kind of thing. But again, for those of you who are going to be nurses and stuff, that's why, when you're around sick people all the time, you have to be very careful about any sort of open wounds. So, if you yourself, if you fall down or if you hurt yourself, and if you have any sort of cut, you always need to make sure that it's covered. You got to keep an eye on it, make sure it's staying clean, because when you're exposed to these bad guys in the hospital all the time, because that's your job, you got to be extra careful. All right. So we talked about phenol a little tiny bit when we talked about Joseph Lister. So phenol was the first disinfectant. So this is the chemical that Joseph Lister used to disinfect his surgical equipment. He would use it on his patient's skin to, kill the microorganisms on their skin prior to surgery. So the problem is that it's very irritating. It's a very strong, it's an alcohol-based chemical. It can be irritating to the skin, and it is very, very flammable. So it was not unusual, once, I told you just a little bit about him. It took a little while for Joseph Lister's ideas to catch on. At first, the older doctors were like, this young surgeon, he thinks he knows better than us. He thinks that he's so smart. He believes that there's these little germs in the air. And this is why when we do surgery, so many people die afterwards. They were going to die anyway. We did our best, right? And then after a year or two, and they look at the numbers and they're like, oh, wow, okay. So his patients, way more of them are surviving, right? And they were kind of like, oh, yeah, maybe he was right. So then when they actually, a lot of them started using the phenol, their like fires would break out in the operating rooms. So they would actually have people, like there were people there whose job it was to put out the fires, because phenol is very flammable, very reactive, because it's an alcohol. I mean, all alcohols are very flammable. So we had to start doing better, right? So that's when we start coming up with derivatives, right? So we have things like biphenol and triclosan, although triclosan isn't used anymore in soaps because there's studies that are starting to see triclosan might be like carcinogenic and all kinds of stuff like that. Very, very low concentrations used in cough drops still. So how like you get when you're sucking on a cough drop and you kind of get that like ooh, like it kind of makes you go like, you know what I mean? That's the phenol. So it almost makes you a little lightheaded. You know, it's almost like mint almost does the same thing. Like you just kind of get like this, woo, like kind of wakes you up a little bit. That's the phenol. So then, you know, the just this chemical revolution, you know, especially in the 30s, the 1930s, the 1940s, just these chemicals just, you know, and a lot of people think that it's doing a lot of harm, you know, just the chemicals that are in the environment now, chemicals that are in the water supply, chemicals in the air, you know, we can talk about it all day. But let's talk about some of these really good ones. So we have chlorhexidine, which is, you know, chlorine based, but it has, you know, it has a chemical makeup that it won't hurt the skin, unlike, you know, chlorine, very caustic to the skin. Very good as a hand scrub. It's used in surgeries. It's used to disinfect wounds, disinfect skin. It's, you know, it's you know, when doctors scrub in, when surgeons are about to do surgery and they got to wash their hands and they wash their fingernails and they wash every little tiny, you know, part of their hands, they're using chlorhexidine. Very, very good. You know, because it doesn't do a lot of damage to the skin, but it's really good at you know, just disinfecting. And then halogens. Halogens work great, and they're not flammable like alcohols are. So we already know about chlorine. We know that chlorine is a fantastic disinfectant. But it can be very damaging to living tissue, especially at high concentrations, right? But chlorine is absolutely essential in our water treatment. Chlorine is why we have safe drinking water in this country. It's something that we completely take for granted in America. You have to remember that more of the world does not have safe drinking water than does have it. So just be grateful for the water that comes out of your tap, because of course, you know, in our country, we drink water out of plastic bottles, but you do pay for the water. Well, somebody, I mean, I pay for mine, but you know, that water that comes out of that sink, you can drink it. And it's safe because of chlorine mostly. Oh, somebody's asking about fluorine in the chat. We're not going to get into fluorine discussion. It's funny because I have a coworker who's he will talk about that. But yeah, we're not gonna get into that. we're gonna stick to chlorine. But yeah, so it's just, you know, the chlorine will kill anything in, you know, the sewage. It has to be treated, cleaned, purified so that we can have, you know, usable water again. And then of course, chlorine is the active ingredient in bleach. It's used as a cleaning agent. Of course, chlorine in swimming pools so that you can go swimming and not have tons of bacteria and viruses and Lord knows what else in swimming pools. I've had the discussion before, you know, if you travel to other countries, if you travel to other parts of the world, especially parts of the world near the equator, you know, tropical regions, pretty much anywhere on Earth that's tropical. If you want to go swimming, do it in a swimming pool. You know, a swimming pool at a hotel with chlorine in it. You know, it's very dangerous to go swimming in a lake, a pond, a river, anything like that in a tropical environment. You have to remember, it's not like the Northeast. They don't have winter. We have winter here. So lakes and ponds and things like that, they get very, very cold in the winter. A lot of them freeze over and everything dies. And then in the spring, things come back and things start, you know, multiplying again. But in the tropical regions of the world, there's no winter. They just keep, making more, whether it's bacteria, whether it's virus, whether it's amoeba, whether it's parasites, whether it's protozoa. And I'm telling you, it's very dangerous, and if you absolutely have to go swimming in one of these lakes or ponds, just keep your head out of the water. If you absolutely you're like, look, I'm only going to be here once in my life and I'm going to go in this lake, just don't go underwater. Because, I mean, there's still things that can burrow through your skin, but just keep it out of your mouth, your nose, your eyes, and hopefully you'll be all right. But I'm telling you, you got to be careful. It's not like the way things are up here. So, all right. And then back to chlorine. Of course, we know chlorine gas will kill anthrax. It's the only thing that kills anthrax besides fire. And then going back up to iodine. So iodine is a fantastic antiseptic. It's a very good, wound cleaner, but it stains terribly. So iodine is used in surgeries. It will, they use it to prep the patient prior to surgery. And you can use iodine at home, if you get a bad cut or anything like that. Now, of course, a bad cut, you can put iodine on it, but you still have to go to the hospital for stitches and stuff. You can use that. I mean, iodine really is the best thing to use. Things like peroxide, rubbing alcohol, they're really not the best things to use for an open wound. I always say you are just much better off to wash an open wound with soap and water. If you get a cut, a cut that's not bad enough to need stitches, just soap and water. Just wash it with soap and water, put a Band-Aid on it. That's the best thing to do, honestly. When you start messing with the peroxide or the rubbing alcohol, you can really do more damage to the tissue than you are helping it, to be honest with you. And, the other thing, depending on how you've injured yourself, you don't want to mess with tetanus. So if you're outside, if you're working in your garage or in your shed, and, even a small cut, it doesn't have to be a big cut for it to be tetanus. So just make sure you're up to date on your tetanus shot. Question in the chat box: is iodine better than chlorhexidine? It depends on what you're trying to do. If it's an open wound, then iodine is better. But if you're talking about just like washing your hands, just like as a topical, like everyday usage kind of thing, chlorhexidine is better. Yeah, so chlorhexidine, like you can actually use chlorhexidine like almost as hand soap, but you wouldn't want to use iodine for that. Like iodine is really more for just like a wound antiseptic. Like iodine is more for, again, they use iodine for surgery prep. But yeah, the problem again with iodine is like if you have kids and stuff, and if you have iodine in the house, and if they get into that or if they spill it, like, yeah, it's not good. Like if you spill iodine on your carpet, you're going to have to just replace the carpet because it's not going to come out. It's once something is stained with iodine, like a fabric, clothing, once it's stained with iodine, it's stained forever. You're not getting it out. There's no way. So that's the big problem with iodine. It's more of a logistical problem than anything else. But yeah, so for like an open wound, type cleaner, iodine is the best. For just like a topical type cleaner, disinfectant, then definitely chlorhexidine is great. But I'm telling you, just regular old soap, we're getting there. Yeah, we're getting there. We're almost there. Regular old soap. Okay, and then of course alcohol. So the biggest problem with alcohol is flammable, very flammable. So that's the biggest drawback with alcohol. And of course, again, depending on what type of alcohol, they can be very toxic. They can be very caustic to the skin. Really just rubbing alcohol. Again, there's a reason it's called rubbing alcohol. It is fine to use topically, but you should not use it on open wounds, because rubbing alcohol on an open wound, it is reactive to the tissue. It will damage, literally, like if you have an open wound and you put rubbing alcohol on it, it will damage the tissue in that, wound. I mean, you're actually doing more harm than good by putting rubbing alcohol on it. But if you were, like the reason it's used is like prior to giving someone an injection or prior to like drawing blood from someone. Yes, if the skin is intact, the skin is unbroken, and then you take rubbing alcohol and rub it on the skin, that will kill any of the bacteria on the skin. And then when you puncture the skin with a needle, you're not introducing any bacteria into the body. That's why rubbing alcohol exists. And then of course you can use it on like surfaces too. Like you could use it to like clean your bathroom and stuff. Just most people don't use it for that. But you have to be very careful with the rubbing alcohol because it's very flammable and it's very toxic. So again, if you have kids and they get a hold of the rubbing alcohol and they drink it, they'll probably vomit immediately, but it can be very damaging to the esophagus and the stomach, to the point to where you have to take them to the hospital. So, it's that kind of stuff, that's why I'm just saying, I am a big proponent of just regular old soap, because regular old soap, even a very little kid, if they put that soap in their mouth, it's so gross. They're going to immediately just spit that out, right? But like, something like peroxide, rubbing alcohol, when it's, a liquid like that just looks like water, it's clear, they'll just be like, oh, what's this? And it, it's one of those things. But yeah, the alcohol being so flammable is also a scary thing. So we know heavy metals work. Of course, nowadays we don't really keep those around anymore at all nowadays because of how toxic they are. But certainly, silver, mercury, lead, any heavy metals like that, they used to be used in medicines back in the day. People, it was not uncommon for people to die because the doctor or, the pharmacist would say, just take a little teeny tiny bit of this and you'll feel better in a few days. And then people would say, well, if I take more, then I'll feel better sooner. But the problem is, if there was mercury or lead or copper in the medication, and if you take too much, it'll kill you. So, we don't use these things anymore because it's just not necessary. We have medications now, penicillin. I mean, I don't even know what the toxicity number on penicillin is. Like you couldn't even probably get enough in a single prescription to do a lot of damage. So, and then we finally get to just good old regular soap or surfactants, if you prefer. So the way that soaps work is different. So soaps are not inherently antimicrobial. They're not a type of chemical that actually kills the bacteria. They work differently. So they work by decreasing surface area. They work with water. So essentially, if you remember your chemistry of water, water has a slightly positive and a slightly negative end. So we kind of get the definition of a polar molecule from water itself. So what soap and other detergents use is they are basically also these polar molecules, but they also have a non-polar component. And the technical term for it is an amphipathic molecule. It's not important. You guys don't really have to know that. but they essentially act as a polar and a non-polar surface. And when they mix with water, they're actually able to wash away anything that is on the surface. And that's how soaps and detergents are able to clean surfaces. So that's why you can clean, your floor, you can clean your car, and you can clean yourself. So when you mix soap and water, and then you put that on your skin, and then you rinse it off, you rinse it away from it, it goes away. So the soap is not killing the bacteria, it is removing the bacteria from your skin or from whatever surface you're cleaning. So that's why I'm a fan, because you're not using chemicals to kill anything. You're not using things like chlorine or iodine or alcohols or anything. You're just simply using a molecule that, when mixed with water, decreases the surface area and just literally rinses it all away. And that's a great way to keep things clean and also to clean things when they're dirty. So if you're just trying to wash your hands to make sure that they're clean, after you use the bathroom or before you eat or before you pick up a baby, whatever, that's great. And then if you've cut yourself or you have a wound and you want to make sure that the wound is clean, just wash it out with soap. You have to have water though. That's the one caveat with soaps and detergents. If you don't have water, it's not going to work, right? So that's when you start the iodine, the chlorhexidine, even like the peroxide, like that stuff works without water. So there is that benefit there. But if you have water available and you have soap, then you can just use that. And one thing I do not like at all, because it is purely a marketing tactic, is antimicrobial soap. When I see that in a store, I get mad, because they're just trying to fool people into buying something they don't need. Why does anyone need antimicrobial soap? Why do you need soap that has an extra ingredient in it that kills bacteria? You're already washing the bacteria off of you. You need the bacteria to be killed when it's in your plumbing down your sink off of you? Like, I feel like, what's the point of killing the bacteria? It's gone. It's gone off of you. It's gone forever. I just don't get it. It's purely to just trick people to spend an extra $1, because it's probably like $1 more. It's like, oh, if I spend an extra $1, I get something that's antimicrobial, and that probably means it's better, right? Because people just don't know. They just don't realize it. And I'm like, no. Like, it just doesn't make sense. I mean, it would be different, like, if it was something that you couldn't use, like Lysol. Like, you're not going to spray Lysol on your hands. That's not a good idea. So it's like, okay, the Lysol, it has a purpose. Like, it kills. Lysol is antimicrobial. It's not a soap. It's a chemical that kills the bacteria, but you can't use it on living tissue. You use it on a surface that's not alive. So it, I guess just get regular normal soap. It works great. But you have to use water. Ah, yes, that's a very good point. Yes. Excellent point in the chat box. So, is antimicrobial soaps helping to drive antibiotic resistance in bacteria? Ha. And I think that's part of the reason why they're taking away the triclosan as well. So yeah, yes, very good point. Interesting, yes. Very good. Yeah, just regular soap is fine. and wash your hands. Wash your hands. Washing your hands is important. As like when the pandemic first started, and all you heard on TV, social media, everywhere, people were like, wash your hands when you go to the bathroom. Wash your hands before you eat. Wash your hands after you sneeze or cough, or when you go over somebody's house, blah, 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 whatever. And I just thought to myself, people weren't washing their hands. Like, people were going to the bathroom and not washing their hands. People were like sitting down to dinner and not washing their, like, I would just think to myself, I'm like, people were really not washing their hands, I guess. Like, it was weird. Like, I have always, like, I need to wash my hands before I eat. And I don't know if it's just because I teach microbiology, because I feel like when you finish this class, you will see the world differently. Like, when you sit down, like, if you go to like anywhere that's in public, like if you go to a public library and you sit down at a computer and you look at that keyboard, it's never going to look the same. When you go to a public restroom, that is never going to look the same after you've taken this class, because you're going to see the bacteria. You can't see it, but you're going to see it. And you're going to think, oh, let me wash my hands real good, right? Anyway, more chemicals. So speaking of controversial chemicals, let's talk about food preservatives. So, you know how some food just never really seems to go bad? That's because there are a bunch of chemicals that bacteria don't want to have anything to do with, like sulfur dioxide and sodium benzoate and sorbic acid and so on and so on and so forth, right? So these are chemicals that are added to a bunch of different packaged or preserved foods. So you get, most of these are foods that go in the cabinet, right? So foods that can stay out instead of foods that have to be refrigerated, right? Because the foods that have to be refrigerated, those are the ones that go bad quickly, right? Or the food that you buy that you got to eat pretty quick, or it'll go bad pretty quick, right? Those are the ones that don't have these things. But the stuff that's been in that cabinet for a couple weeks and it still tastes good and there's nothing wrong with it and it doesn't look weird and it doesn't smell weird, read the ingredients. And I bet there's a lot of things on there that you cannot pronounce. And this is why. There's chemicals in there that the bacteria, they're just like, what is this? This is weird. I don't want anything to do with this. And the bacteria don't go anywhere near it. But it keeps it fresh and it doesn't go bad. And again, lots of theories out there about what this stuff does to us, but we're not going to get into any of that because that's not what we do here. Yeah, in the chat box, that's funny. Well, I haven't had that in a long time. I would probably get so sick if I had anything like that to eat. All right, then we have antibiotics in cheese, which those are naturally occurring. Most cheeses have naturally occurring antibiotics because most cheeses have naturally occurring fungus that is, produced. Anything that is an actual cheese. And by the way, American cheese and most cheddar cheeses, that's not like real cheese. That's like fake cheese. But most things that are actual cheese, that is milk that has been essentially curdled by some sort of fungus or bacteria, and instead of turning it into yogurt, they've turned it into cheese. It's very fascinating stuff. Like if you do any sort of research on milk and yogurt and cheese and how they make these things, it's really, really fascinating stuff. It really is pretty cool. And again, I wish we could talk about this stuff. It is microbiology. It's just not our microbiology. It's other microbiology. There's food microbiology and industrial microbiology, environmental microbiology, so much stuff. All right, and then we have some other chemicals. We have aldehydes. I'm sure you've all heard of formaldehyde before. So formaldehyde is a type of chemical that preserves dead tissue, prevents bacteria from breaking down dead decaying matter. It's used to preserve, dead stuff, so it doesn't rot and decay and turn back into its corresponding elements. So we can preserve organs and bodies for, dissection, study, et cetera, et cetera. Don't need to get much more into that. And then certain gases, we already talked about chlorine gas. There's other types of gases out there that are used as sterilizers. And then peroxide is just another one. So we didn't technically talk about it, but peroxide is a topic in chapter 6. So if you haven't gone through chapter 6, you haven't done the peroxide stuff yet. But peroxide is another chemical that can be used as a disinfectant. It is, I would say, in terms of using it on a wound, a little bit better than rubbing alcohol, but not by a lot. Peroxide, again, it's very reactive, it's very caustic. I do think it's a bit more of just kind of a marketing type thing. But if you do have blood on fabric, clothing, that kind of thing, it does work really good at cleaning up blood in that respect. And I know that from being a vet tech. So when you are clipping toenails of a dog and you clip it a little too short and the dog freaks out and sprays blood everywhere and you have a bunch of blood to clean up, peroxide works very well at getting blood out of things. So now you know. Yeah, so various different oxygen derivatives are effective disinfectants. And again, that's also covered in chapter 6. Now, this is a good list. We've talked about pretty much all of this stuff. I shouldn't say good list because it's actually a terrifying list. But this is essentially our list of various different microorganisms in order of least resistant to most resistant. Now, I will ask you some of this, but it won't be the entire list. So it'll be questions like, which of the following is the most resistant, out of these 4, that kind of stuff, or, which of the following is in the right order from most to least or least to most. So you still want to know it, but it's not going to be tons and tons of questions. And the questions will be questions that I feel like you really should know if you've been attending classes, if you've been paying attention, because a lot of these we have talked about, right? So first we have lipid enveloped viruses. We haven't talked a lot about those, but then of course we've talked a lot about gram-positive bacteria, then we have fungus, then we have non-lipid viruses, then we have gram-negative bacteria, then we have mycobacteria, which one of which is the causative agent of tuberculosis. Then we have protozoa, endospores, and then prions, disease-causing protein particles. The most well-known one, of course, is mad cow disease. So if we think about this, right, I have definitely said that for the most part, gram-negative bacteria is considered to be more resistant and more dangerous than gram-positive bacteria. So there's that one, right? And then protozoa, right, is usually more resistant, more dangerous than most types of viruses and or bacteria. Then we know for sure endospores is going to be at the top of the list when it comes to most resistant, because endospores, like, hello, they're endospores, right? And then we know, like, fungus, I've even said tonight, fungus, we don't really worry too much about fungus. The only time we really worry about fungus is usually people who are HIV positive or who have full-blown AIDS. Those are usually the patients that we really worry about fungal diseases. And then prions, again, prions, one of which is mad cow disease. extremely rare. Some of the most rare diseases known to man, but also some of the scariest. So I would say, maybe 3 questions on the test at most. But if you know things like, gram negative, for the most part, worse than gram positive, right? Fungus, not so scary. Endospores, very scary. If you know that, then you should be all right when it comes to this list. All right, that is it for chapter 7. So what I want to do now is let's just go ahead and take a 5-minute break. You can get up and stretch, maybe go get a quick drink, all that. So 5-minute break, come back, and we will jump into chapter 14. All right, here we go. Back at it here with chapter 14. So like I said, chapter 14 is kind of a bridge between unit 2 and 3. It's not really so much about the, destroying the bad guys, dealing with the bacteria and all that. It's more kind of getting into now the, more about diseases, more specific. So once again, starting off with a whole bunch of vocabulary words. So once again, make your flashcards, make sure you know your definitions. I would say make sure you know them word for word. Don't get anything mixed up or switched around. Most of these talk about, we've definitely done, pathology, infection, disease. You guys definitely want to know nosocomial infection. That's super important for nurses, healthcare professionals. Etiology is one that sometimes confuses people or people use incorrectly. So etiology is literally the cause. So Streptococcus pyogenes is the etiology of strep throat. Mycobacteria tuberculosis is the etiology of tuberculosis. So that's how you use the word etiology, literally the cause, the actual organism that causes the disease. And that'll be very important to use that correctly for your project. So that kind of brings you back around to the project. So don't forget, we mentioned that before. Yep, so just make sure you know all of these words. I would say probably all of them are on the test. So just make sure you know those. As far as the symbiotic relationships go, I mean, yes, you want to know these. It's, probably the most important thing, or the thing that happens very often, is because mutualism is, in a way, kind of like the best one, like the most ideal one. Mutualism is the one that gives you kind of like the happiest feelings, right? So I asked the question on the test, which symbiotic relationship is the most common? And students will often want to choose mutualism, but that's not it. Okay, mutualism is the best one, like the most ideal one, but it's not the most common. It's not the one that happens most often. Okay, the one that happens the most often is commensalism. So commensalism would be the vast majority of the bacteria that lives on us or in us. And we call that bacteria your normal flora or your microbiota. You can pretty much use those terms interchangeably, although normally you would say if it's in you, you would say your normal flora or your microbial flora. And if it's on you instead of in you, you would say your microbiota. But it doesn't really matter. I mean, I would not ask you this on a test. I would not make you say the difference between these two. And I've mentioned this a couple times already, okay? You have to just get over it. Is as long as you're on this planet, which I would say for all of us will be our entire lives, right? You are surrounded by microorganisms, right? There is bacteria on you, around you, in you, all the time. It's the reality of living on Earth. So, right, we have bacteria that live on our skin, in our mouth, right, in our intestines, all the time. And we call that our microbiota. Now, the vast majority of this bacteria does absolutely nothing to us. Nothing. And that's commensalism. Okay? The bacteria has a place to live. We are giving the bacteria food and shelter. So the bacteria is happy. They have a place to live. A nice, warm place to live. We get nothing. And so I'm going to turn my camera off because my camera is, I don't know if you guys are seeing it, but on my end, it looks weird. So I'm just going to turn it off. So hopefully everybody should still be able to hear me, but it's distracting me and I don't want it to distract any of you. So that's what commensalism is. And I want everyone to understand that, you know, so mutualism is when both benefit. So it's called the mutualistic bacteria. This is the bacteria that is helping us at the same time that we are giving it a place to live. So this would be like the bacteria that live in our large intestine that's also making, you know, vitamin B or vitamin K for us. So it's the good bacteria. Okay, that's mutualism. That's wonderful, right? So we have bacteria that's doing something good for us and we're doing something good for them and everybody's happy. Okay, that's mutualism, but that's rare. Right? That's not like a every day, all the time kind of deal. The vast majority of bacteria is commensalism, right? We're giving it a place to live. The bacteria is happy. We are totally unaffected. We are not being helped. We're not being hurt. We are completely unaffected. So the third one, parasitism, those are the bad guys. That's the pathogenic bacteria. Those are the ones that hurt us. Those are the ones that make us sick. So the bacteria is happy. The bacteria has a place to live, but we're being hurt. We're being harmed. And that's parasitism. Okay? So just make sure you know the definitions of the 3 different types of relationships, but also make sure you understand that commensalism is the most common one. That's the one that's going to be happening more often by far than the other 2. So now I'm not going to spend a lot of time on this because I want to make sure we have enough time to talk about the test, but I love this topic and I'll definitely talk more about this topic in chapter 15 after, you know, exam 2 is all over and done with. But these are the locations of the normal microbiota. So of course, the biggest one by far is our skin. So our whole entire integumentary system, you know, from the very top of our head to the very tip of our toes, covered in bacteria, right? And, you know, it's fine. As long as you don't have any wounds, as long as your skin is intact, the bacteria is not going to do anything. It's just living there because you're on Earth, and that's that. Then, of course, anything exposed to the outside environment will also have bacteria that can get in there. So our eyes, right? As long as you're awake, as long as your eyes are open, bacteria is going to get in there. That's why we have a mucous membrane called the conjunctiva. That will help protect us from bacteria. We also have our tears. Our tears have lysozyme in them. That will certainly help protect us from any bacteria in our eye. And, you know, we'll talk about immune system stuff later on in Unit 3. And then, of course, our nasal passages. So our nostrils, our, you know, our throat, then, of course, the mouth as well. So all of that stuff is exposed, right? So, of course, our immune system will come into play. We have, of course, our ciliated epithelium, which is very important. We'll talk about that, chapter 16. Brushing our teeth is very important for the health of our mouth. Talk about that at some point. And then our saliva, of course, has lysozyme. So all kinds of ways to protect us from the bacteria. And then, of course, you will notice a very obvious gap right here. And, you know, this is just another favorite topic. Okay. So internally, this is, of course, where our stomach is. And this is where it all comes to a screeching halt, because our stomach, the bacteria is like, no way, do not want to be there. All of that acid, all of that churning, nope, don't want to be there. So any of the bacteria that we might be swallowing, any of the bacteria that we might, you know, when we cough, when we clear our throat, when we, you know, any of that kind of stuff that's, you know, kind of throat related or swallowing related, anything that ends up in our stomach, stomach acid kills it. Stomach acid is very strong, very powerful. You know, bacteria, viruses, fungus, pretty much anything, not everything, but, you know, there are some things that can make it through there, but vast majority of things, if it's in the stomach, it's dead, it's killed. So then, of course, the large intestine, the other end, I'll just say it that way. If you haven't had AMP2, you haven't discussed the digestive system yet, but there's another end to speak of. That is also exposed to the outside environment. So the large intestine has quite a population of bacteria. And then, of course, the urinary system and the reproductive systems are exposed to the outside environment. So there are various microorganisms associated with those as well. The actions of urinating will help to cleanse the urethra, which is very important to keeping any bacteria out of the bladder, out of the kidneys, which, you know, obviously urinary tract infections are a thing. That's like pretty much our last topic of the entire class. But, you know, there are certainly ways of protecting those parts of the body as well. So some of this stuff we will come back to in chapters 15 and 16. Other stuff we'll talk about in those appropriate chapters when we get to those body systems. But very interesting stuff to talk about for sure. Okay, hopefully you all remember Dr. Koch. He is the guy who gets the credit for proving the germ theory. So he's the one who made Louis Pasteur really mad because Louis Pasteur wanted that credit and he didn't get it. So this is the guy who proved that anthrax caused by a bacteria. And essentially, this is how he did it. So his steps became known as Koch's postulates. And, you know, this is essentially how he did it. But of course, this is a really long time ago, right? So we're talking 100 years ago. And, you know, we've kind of moved past these. So I just like to bring them up. I like to kind of show these to you. And of course, I'll show you the picture from the book. He killed a lot of rats, as you can imagine. And now, of course, I can't find the darn picture. Where is, here we go. Page 399. So, I'm not going to really put a lot of questions. I mean, I think there might literally be like one question on the test about Koch's postulates. But, just to understand kind of how he proved that anthrax, was actually caused by this bacteria. So, harvested, fluid from the dead animal, cultured that in a petri dish, observed it under the microscope, then, inoculated a healthy animal with those organisms. That animal dies, again, harvest it from that animal, and then shows that it's the same organism. Okay, that's what he did. After he proved it, countless other scientists, doctors, researchers started doing the same things with, hundreds of diseases. Okay, and there were a lot of results started pouring in for decades and decades. And you can imagine that some of the results were, very helpful, and some of them very confusing. And we'll talk, about that in the next slide here. So, not a lot of this is done this way anymore because we don't need to anymore. Our technology is so far beyond this now. I mean, so far beyond what they had to do 100 years ago. It's hard to even talk about how far the technology has come these days. The things that we can do with genetics, it's really just astounding what we can do with disease research now. A perfect example is with the COVID vaccines. And I know, when you start getting involved in the politics of it, it really takes away so much of it. But when you think about how quickly, viable vaccines were produced, it's because that's how far our technology has come. It's the same thing. Look how quickly they make the next iPhone. How many years did it take for like the second iPhone to come out versus like, I don't even know, what are we on, like 25 or something now? So that is a testament to our technology. Is, we can identify things at, the sub-molecular level now, where 100 years ago, we still had light microscopes. They couldn't even identify viruses. And now we can identify the bases that make up the DNA of a new virus. We can do that in months instead of decades. So it's pretty incredible stuff. So you can imagine some of the issues that they ran into, right? So there are microorganisms that you cannot culture in a petri dish, right? There's bacteria that will just simply not grow in an oxygen environment, right? I mean, you couldn't do this with botulism, for example. So, and then, there's diseases that don't have any kind of exact list of signs and symptoms. Different people are going to be affected in different ways. So that's going to be hard to, apply to Koch's postulates. And then, of course, we get into this whole, what about viruses? You can't even apply anything that he did with viruses. You just can't. You can't grow viruses in a petri dish. You can't You just can't. So it just doesn't work. So there's lots of exceptions, right? Lots of issues. And then of course, there are diseases that only exist in humans, and you cannot experiment on people. At least you can't experiment on people legally and ethically in this country and in, I'm going to say what, most countries on earth. But you have to remember that, you know, there are a good number of countries on earth where experimentation of this sort on human beings is allowed. And not only is it allowed, the government supports it. So, you know, that's scary, you know. And the other thing too is 100 years ago, even, you know, 60 or 70 years ago, in the United States, we experimented on people with diseases, with disease research. We gave people diseases just to see how their bodies would react to it. So if you don't know what the Tuskegee experiment is, I suggest that you look that up, because that's something that was done in this country. And it wasn't even 100 years ago. So again, I mean, killing a whole bunch of rats and mice is one thing, but when you're doing it to humans and your excuse is, well, we're trying to save other people, you know, it's definitely not going to fly nowadays in this country. And, you know, even ethically, it's certainly not acceptable, but with our technology, it's not acceptable. And honestly, even killing rats and mice, we don't have to do that anymore with our technology. The technology that we have at our disposal in this country, we can do everything, you know, it's called, you know, in vitro. We don't have to kill animals anymore. But, oh, here, I'll type it in the chat box. Okay. All right, more vocabulary. I gotta check my time here. Okay, I'm not doing as bad. I was worried it was closer to 7. All right, more vocabulary words. I think that you pretty much know all of these, especially living through, well, you've lived through one of these words for 2 years because the word pandemic is there. So I'm sure you all know the definitions of endemic, epidemic, and pandemic by now. I'm sure you also know acute and chronic. So the first two are, you know, are the one, if you're going to get any of these wrong on the test, the first two are the trickiest, I think. So incidence and prevalence. Okay, so incidence is the spread. Prevalence is the seriousness and duration. All right, so very easy to mix those two up. So don't mix up those two. But I think the other 5, those are hopefully pretty easy. But you definitely want to know all of these vocabulary words, definitely on the test. So you want to know those. So local infection, that's pretty easy. That's just when the infection is in one small part of the body. Systemic infection is when it's throughout the entire body. So the infection has spread through the blood or through the lymph. And then the third one is weird. So the third one is called a focal infection. This is when a local infection spreads, but it just spreads to one other single part of the body. So it's, you know, a little bit of a weird one, but I will tell you that one of, you know, if you think about our like top 3 list of like bad guys, right? At the top of that list is probably going to be Streptococcus pyogenes. And strep pyogenes is very well known for causing focal infections because it loves to start out as strep throat, which is a local infection. And if you don't get the strep throat taken care of, it gets into your bloodstream and it goes to your heart. And it can cause an infection of the heart. And it becomes very serious at that point. And that would be considered a focal infection. So you have strep throat, but then you also have an infection of the heart. So that would be one example. And that's the best example. I don't know if I can come up with another really good one, off the top of my head. But, that is the best example of a focal infection. So just treat these as vocabulary words, know the definitions, but just so you have an example of a focal infection, because that one's kind of weird. That's a weird definition. And then sepsis, we kind of already had the word asepsis, so now we have the word sepsis, a toxic inflammatory condition from an infection. And then septicemia, so you want to make sure you get this one. Septicemia is blood poisoning. So don't get sepsis and septicemia confused. Just think septicemia is blood poisoning, and then the other one is the other one, right? So on the test, as soon as you see the words blood poisoning, just think septicemia, and hopefully you're good. Hopefully you'll get that one right. But septicemia would be another example of a systemic infection. But I would just say, as soon as you see blood poisoning on the test, just think septicemia. You'll get the question right, and hopefully good to go. Okay, so primary infection, I think that's obvious. That's just, the infection. You're sick, But then we have this idea, which I brought up before when somebody asked the question about Pseudomonas, this idea of an opportunistic infection or an opportunistic microbe, okay? So this is when, somebody gets sick and then they have something else that essentially takes advantage of that weakness, okay? So this usually happens with someone who already has a weakened immune system to begin with, okay? So we're talking a young child, so it's usually someone under 4 years old, an elderly person, so someone over 60 or 65, someone who is HIV positive or someone who has AIDS, someone who has had an organ transplant, or someone who has had certain types of cancer, okay? Those are the main groups of what we say immunocompromised. So people that have weakened immune systems, okay? These are the special groups that we have to worry about when it comes to secondary infections or opportunistic infections, all right? So let's say they have the flu, they have a cold, they have COVID, whatever, okay? They get sick, something that someone who has a healthy immune system, someone who doesn't have those other, issues, okay? They're not going to worry so much about getting a secondary infection. But it can happen. I mean, you can have a regular, normal, healthy adult, right? Maybe they get the flu and they have a particularly bad case of the flu, or maybe they have a bad case of COVID, and then they end up with like pneumonia, right? So that pneumonia would be the secondary infection, right? So this is what I was saying before about Pseudomonas. Pseudomonas likes to do this kind of thing. So let's say, and let's stick with bacteria. Okay, so let's just say you had pneumonia. Okay, so let's just say it's winter time, you got sick, you had pneumonia. Okay, and you're trying to get better from this pneumonia, and maybe you, I'm trying to think like how you would actually have this happen to you. I guess you would have to be, probably working at a hospital or something, and you get a cut, right? And then the Pseudomonas gets into the wound, and the Pseudomonas will be like, "Oh, you're sick, and you have a weakened immune system, and now I'm going to get you." It's like that kind of thing. All right. Now, the flu virus will also do this too, because like if you get like a cold, like you have the common cold, and you just, a lot of times when you have the cold, you're not like sick, you just kind of feel a little sick, right? So maybe you're not taking good care of yourself because you only feel a little bit sick, like you're just a little run down, but you're still trying to go, you're going at all cylinders, you're still trying to like go to work, you're still trying to like do everything you usually do, and that's weakening you, right? And then the flu virus comes along, and the flu virus is like, bam, and hits you really hard, right? So the flu would still be the secondary infection, but now you've got a cold and the flu. And that happens. I mean, that can happen to a regular healthy adult, but it definitely can happen to elderly people, people with AIDS, and that could actually kill those folks. I mean, that is what will often kill someone with AIDS or someone who's older. They might have a cold or the flu, and then they get something. Hold on. I've been talking too much. So yeah, secondary infections, very dangerous for anyone who would be considered immunocompromised. Sorry, my voice is giving out on me here. All right, and then a subclinical infection is basically something I mentioned before when we were talking about the difference between an infection and a disease. Someone who has the infection, but they don't have the symptoms. So you wouldn't even know you have it unless you actually got tested and the test came up positive, but you otherwise feel fine. That would be a subclinical infection. All right, so you want to know the 5 stages of development of disease. So make sure you know these 5 stages in the correct order. And then you want to know what happens in each stage. And sorry, I can feel my my voice giving out on me, so I'm going to have to just kind of go through these, not as detailed as I would like to, but you guys will be all right. Like I said, just know them in the correct order and then know what happens during each stage. So just kind of treat them as definitions. All right, so you want to know the definition of a reservoir, which is a source of disease organisms. So of course, people can be a reservoir. So like, how do you get the cold? How do you get the flu? How do you get COVID, right? How do you get a sexually transmitted infection? You get them from other people. So people are the reservoir. And then you can get diseases from animals. Those diseases are called zoonoses or zoonotic diseases. Those are diseases that humans and animals can share and transmit to each other. Things like rabies, anthrax, and ringworm. So rabies is a virus, anthrax is bacteria, and ringworm is a fungus, not a worm, but a fungus. Now, of course, rabies is extremely rare because we vaccinate our dogs and cats for it, and we keep them away from skunks and raccoons. Anthrax is pretty rare too, and anthrax is usually more like farm animals, like cows and horses. But ringworm is fairly common. And ringworm, especially if you have younger kids, like kids that are like in daycare, kids who are in kindergarten. And I just always want to mention, because it's important to know, if you have, really young kids, and if you also have pets, if you also have dogs and cats, because your dogs and cats can give ringworm to your little kids, and then your little kids can give it to your dogs and cats. So if your little like 3-year-old or 4-year-old comes home from daycare and they got ringworm from one of the other kids, and they come home and they play with the dog and they're hugging the dog and stuff, the dog can get ringworm from them, and then you got to take the dog to the vet to get medicine for the ringworm. And ringworm is much more obvious on your pets because their hair will fall out and they'll have like a big bald spot on their body. Whereas with humans, a lot of times, like, humans will get it like on our arm or on our leg. And especially if it's a kid, you're not going to notice it as much. But, on a dog or a cat, you're going to see a big bald spot and you're going to know, oh, this is weird. But anyway, that's, again, my vet tech background coming out there. Sorry about my voice. It's been a long day and I've been talking a lot here. Page 405 has some of those zoonotic diseases. And if maybe you weren't sure about a topic for your project, maybe look at some of those. Maybe you'll get some ideas for your project from that list. And then, of course, we have some non-living reservoirs, soil, water, food, other sources of diseases. So, of course, contaminated, non-living things can have bacteria, viruses, whatnot. So then actually transmitting the disease, or how do you get it? Well, you can have direct contact. So, touching, hugging, kissing, body to body type contact with either another person or an animal. That's direct contact. Indirect contact would be touching like a doorknob, a cell phone, a keyboard, and that object that you touch, like the doorknob, that's called a fomite. And that will become important for lab on Thursday. So we'll definitely mention that on Thursday. That's lab 6. And then droplet transmission. So this became a big important thing during COVID. This is why we wear the mask, right? Because we know through coughing, sneezing, even talking, right? Our basically our spit, right? Our sneezing, coughing, that stuff that we give off, that will also transmit infectious agents. Vehicle transmission is, again, through food, water, the air, the medium, the source. And then we have vector transmission. So a vector would be something like a mosquito or a tick or a flea, some sort of like insect that's going to bite you or transmit it through, touching you, that kind of thing. So of course, the big one, the one that kills the most people by far, is the mosquito. So mosquitoes kill more people each year than any other animal, and it's by a lot. Mosquitoes kill over 1 million people a year because of all the diseases that they spread. All right, so nosocomial infections that are acquired from a hospital stay. So this would basically be, if somebody is, say they're in an accident, they break their leg, they have to go to the hospital for surgery. And then while they're at the hospital, they get the flu, or they get like MRSA, or they get like eye infection from Pseudomonas, something like that. That's what would be a nosocomial infection. So of course now, some of the things the hospital staff can control, like through hand washing or proper disinfection, but a lot of things you can't control. You can't control the fact that we have things like MRSA and Pseudomonas, that are very strong, very resistant organisms, right? And you can't help the fact if someone is immunocompromised, if someone is younger or older, or if they have burns, or if they've had an organ transplant, you can't do much about that. You just have to try to manage it as best you can, really, but definitely you want to know the definition of this one. And it'll be something that certainly will be, in your job as well. Okay, an emerging disease. Again, we've lived through this for 2 years because we've lived through a new disease. So it can happen for a variety of factors. Of course, we know with COVID, it was just literally a new virus. It was related to the SARS virus, but it was a brand new SARS virus that just we've never seen before, and our bodies didn't know how to react. And that's why people, we got so sick, because our bodies didn't know what it was. So the table on emerging diseases is on page 412. And it also has some years. Of course, I'll never ask you any years. Okay, this isn't history class where you have to know all the years of different things that happened, but you might find some of these interesting. And again, maybe some ideas for your project. So if you're struggling for some interesting ideas for your project, maybe that'll be helpful to you if you look at some of these lists that I'm mentioning. So why does it happen? A lot of it is genetics, a lot of it is evolution, right? Antibiotic resistance is related to evolution. So antibiotic resistance is how we ended up with MRSA. MRSA is just a strain of Staph aureus. Staph aureus was never a big deal until MRSA just kind of, came out of nowhere. This is an interesting one. This is a theory behind possibly one of the reasons why COVID happened is relationship with global warming. Because we know for sure that bacteria and viruses, they both like it when it's warmer and more humid. So as the earth gets warmer, perhaps the bacteria and the viruses will become more numerous. Maybe they will become stronger. And that's going to be an issue, right? Transportation to new areas. This is why Ebola found its way to America for the first time a few years back, because someone got on an airplane and they were not sick. They were not feeling bad at all. And then by the time they got here, they were symptomatic. So first time that has ever happened before. So that's because our planes have just gotten that much faster. Ecological changes due to natural disasters, human-caused disasters. So, hurricanes, floods, even, warfare, that kind of stuff could also cause emerging diseases. Ineffective animal control. So rabies would be one of the biggest ones with this. Not vaccinating animals for certain diseases. That can certainly be a very scary one. Ineffective public health measures. So that one would be like sexually transmitted infections. So anytime you see a rise in gonorrhea, chlamydia, issues surrounding HPV, the list goes on there for that one. And then epidemiology is another one that's been in the news all the time now because of COVID. That's what the CDC does for our country. Pretty much any developed country is going to have some sort of database, some sort of government body that's responsible for collecting data and statistics on diseases. Now, just so you're all aware, as future healthcare professionals, on page 416, there are many, many diseases where you are required by law to report to the CDC anytime that a patient has tested positive for those diseases. Now, of course, you're not allowed to identify the patient in any way. You just literally have to check a box that says, this is how many people, I don't know if they do it weekly or monthly. My guess would be weekly, depending on the size of the hospital. But yeah, there's a huge list of diseases. Again, it's on page 416, that you have to actually report and say, if anybody's come up positive for that particular disease. Okay, so that is it for chapter 14. All right.